Namaskar, I am Dr. Sky Sharma, spinal physical therapist. Welcome back to my YouTube channel. So today we are again going to discuss about a condition which is very common. So today we are going to discuss about the ITBS. ITBS is iliotibial band syndrome. So before understand the ITBS, need to understand what is IT band. So in the entire video we are going to discuss what is IT band, what is IT band syndrome, what are the common causes of IT band syndrome, and how the clinically present a patient. If patient is suffering from the ITBS, how patient feel, what you can observe in the patient. So clinical presentation, sign and symptom of the IT band, and incidence, how common it is in India. We will discuss about that, and how we can manage clinically, and the diagnosis, how we can diagnose IT band syndrome, and finally our favorite part, the physiotherapy management and the home exercise program for the IT band syndrome. So if you find our video content is informative, it is helping you in any way, please do not forget to support our channel by like, share and subscribe. So if you want to understand everything about the IT band syndrome, please watch our video till end. Let's start. So IT band, what is IT band? IT band is a connective tissue or the fibrous muscular band which starts from your hip bone to shin bone. We are calling this iliotibial band. Ilium is the part of your hip bone. Your hip bone is made up of three parts. First is ischium, ilium and the pubis. So ilium is the one part of your hip bone. So your IT band, iliotibial band, start from the ilium and ends at the tibia. Tibia is your shin bone. So start from the ilium, the part of the hip bone, and end at the tibia, that is your shin bone. That's why we are calling this iliotibial band. So two muscles get attachment over this band, that is first gluteus maximus and the second is tensor fasciae lata. So TFL and the glute maximus, two muscles get attachment over this band, and this is fibrous muscular connective tissue or band, start from above, just above your hip joint, and it cross your knee joint. So need to understand, this is two joint muscle or two joint structure. This is the longest structure which is crossing your two joints. It start above the hip joint and end or attached below the knee joint. So this is two joint structure. So it is starting your pelvis, okay? This is your pelvis, hip bone, ilium, pubis and the ischium. So ilium is this part. So it is your hip joint. So this fibrous band start from the ilium, cross your hip joint and laterally means outside from the leg, outer side of your leg. So it travels down till your knee joint. So the entire band is traveling down from hip to knee, but on the outer side of your thigh. Thigh bone is your femur. So this is a little bit complicated, but I am explaining in detail because some of our audience is physiotherapy students. That's why I am discussing in the detail. So you can feel the pain outer side of your hip joint, outer side of your knee joint, or the outer side of your thigh. That is very common. Whenever a patient complain of pain, he or she is feeling pain which is coming down your leg, always it is mimicked or it is a myth कि that's the pain is coming from your spine. So all the pain which is coming down in your leg, it cannot be always from your spine. It is separate thing and it is a local muscular problem. Okay, hope I am clear so far. So iliotibial band is a structure, start from the hip joint and at the tibia your shin bone. What is iliotibial band syndrome? When this band is tight, inflamed, causing pain, it reduces your flexibility when you are running, jogging, walking, doing exercises. You are feeling some kind of pain, inflammation, redness or irritation. in this band. That's why that time we called this condition iliotibial band syndrome. So what is IT band and what is IT band syndrome? When your IT band is inflamed, red, painful or inflamed. Okay, so what are the common causes? First we discuss about the incidence, how common this is in India. So every year in India more than 1 million cases are there. So reportedly more than 1 million cases with the IT band syndrome in India per year. So you can think how common this is. That's why we are discussing here. So let's begin the common causes of IT band syndrome. Why this band is painful, why this band is tight. First cause is xenoverum deformity or the bow leg. If your knee joint has the deformity, we call the bow leg, means your knee joint is away from the midline and your feet are together, your ankles are together. This deformity called the bow leg or xenoverum deformity. Because of this deformity, your IT band can tight. It can cause some irritation. So first cause is bow leg. Second, limb length discrepancy, LLD. If your one leg is short and another leg is long, it can be because of some trauma, it can be congenital from your birth, but there is some discrepancy in your leg lengths. Both legs are not equal. In that condition also there is chances to get IT band syndrome. First, and another cause is the athletes, those are running on the uneven surfaces or downhill or uphill. Few people run on the uphill or downhill on the curved surfaces, not even surfaces. In that cases also people can get this IT band syndrome. The another reason is hip abductor muscles weakness. If your hip abductor muscles are weak, in that cases also you can get IT band syndrome. After that, one more reason we can see, like if you do so much of exercises but your cooling down period and the warm up period is not sufficient enough, in that case also there is chances to get tight IT band. Another reason is your internal rotation of the tibia. If you have tibial torsion, tibia is your shin bone, you have internal rotation of the tibia or the tibial torsion, in that case your feet are inverted. In that case also we can see the IT band is tight or IT band is getting some irritation or lack of flexibility of the IT band. So after that we will discuss about the symptom. Let's talk about the sign and symptom or clinical presentation of the patient with the IT band syndrome. First, whenever you will examine the patient, you can see there is some redness or some discoloration of the skin around outer side of your knee joint. Knee joint, whenever patient complain pain in the inner side of the knee joint, most of the cases this is because of your osteoarthritis of the knee, but patient is complaining pain outer side of your knee joint, it can be because of tight IT band or IT band syndrome. The second sign and symptom you will get the bow leg. We have already discussed about that. It can be a cause or it can be a presentation of the patient. Whenever you will observe the knee joint of the patient or the legs, you will see there is difference in the leg length, there is difference in the alignment of the knee joint. Patient knees are like that, bow leg. So you can see this in the clinical presentation. And third clinical presentation sign is you will ask the patient, you just sit down and stand up. Sit down and stand up means you will ask the patient flexion or extension of the knee joint. Flexion means bending of the knee joint and extension means the straightening of the knee joint. Whenever you will ask the patient, please perform the knee flexion or extension. After doing repetitively knee flexion and extension, patient might complain there is some irritation outer side of my thigh. Why this is happening? Because your IT band is tight. Whenever you are doing the flexion extension, your IT band, tight IT band get rubbed get rubbed against your femur, thigh bone. That's why it causes irritation, but it will happen when only your this band is tight. If your band is flexible enough, you are absolutely perform multiple time of flexion extension. There is no any kind of irritation of the IT band. So if your IT band is tight, you will get some irritation or rub against your thigh bone while performing the knee flexion and extension. So the another sign you can see or the symptom whenever you will perform examine the knee joint, you can see some pop like pop or clicking sound or some snap kind of sensation in the knee joint. You will perform knee joint examination, you can hear the some clicking sensation in the outer side of your knee joint if your IT band is tight. Now the next symptom is, initially the pain will feel only after the exercises. What happen if you are like just your IT band is tired, it is not very chronic condition, just acute, it just started now. In that case you will feel the tightness or the irritation of the IT band only after the exercises. Okay, gym activity or running, or whenever we are performing some physical activity, exercises, gymming, after that your gym session or exercises you will perform the tightness, but entire day you are relaxed. But if this condition is getting worse, it is now more acute or you are getting worse, in that case you will feel the entire day is the tightness. And one more thing I want to discuss, in the chronic cases it is like dull sharp pain, but in the acute case you will feel the sharp shooting pinching kind of pain sensation. So we discuss about the what is IT band, what is IT band syndrome, then we discuss about the common causes of IT band. We have already discussed about the common causes, sign and symptom, and the clinical presentation, and what kind of pain you will feel in the knee joint. Okay, and now come to the clinically management, how to diagnose the IT band and what are the initial management of IT band syndrome. Let's talk about how to diagnose ITBS. ITBS can be diagnosed through the clinical examination only. There is no such radiological examination or the blood test to diagnose ITBS. So your medical practitioner, your physiotherapist will examine you clinically through your sign and symptoms, your clinical presentation, or your routine activity through your just to take your history. How do you perform activity, how do you running, jogging, or do you do physical activities or the gymming. So through the clinical examination, your history taking or your clinical presentation, your therapist will diagnose ITBS. And there is some physiotherapy examination, the part of some physiotherapy examination, some special test, some physical examination, or the some special test like Ober's test, Nobel's test. Physiotherapy understand these tests. So after performing these physical examination, special test, your physiotherapist or your medical practitioner will diagnose you are suffering from ITBS. Okay, so after diagnosis, let's start management of ITBS. The first line of treatment of ITBS is rest. Rest does not mean you are lying on the bed entire day. Rest means just avoid the activities which is provoking your pain, like gymming, running. You can stop that activities and just give rest to your muscles or your legs. Avoid heavy exercises for your leg. You can wear proper shoes. Shoes is very important. Always wear proper sport shoes or running shoes while you are running. Avoid running on the downhill or uphill. Always try to run on the flat surfaces, row surfaces, or the track, but avoid running on the uphill or downhill. You can wear proper shoes and the posture. Always take care of your posture, whether you are sitting, you are standing, you are running, you are doing gymming. Wherever you are, just take care of your posture. That's very important. Your entire body weight is coming on your legs, so it's important to take care of your posture. So good posture is important, good proper fitting of the shoes is important. Running shoes, sports shoes you can wear, and do just, you can use ice pack. If you have so much of aching dull pain in your thigh or lateral aspect of your thigh, or the around the hip joint or knee joint, you can put ice pack for the 10 to 15 minutes 3 to 4 time in a day. You can do icing, rest, avoid activities, wear proper shoes, take care of your posture. Or if you have unbearable pain, you can take some painkiller, but avoid taking painkillers if possible. Try to do rest and icing. If you have a nearby physiotherapy center, you can visit there, and you can take ultrasound or IFT for 1 week to 10 days. You can take that, or you can take myofascial release. Your physiotherapist will give you some myofascial release is a technique which provide relaxation of your soft tissues, just to release spasm or tightness of your soft tissue. You can do that. Now start home exercise program. You can do stretching of the IT band, you can do strengthening of the IT band, you can do myofascial release at home, you can do icing at home. So a part of these things, how to stretch IT band, how to strengthen IT band, we will discuss. Let's start home exercise program with the physiotherapy management of ITBS. As we discussed, we can feel pain on the outer side of your thigh, outer side of your hip joint, outer side of your thigh, or the outer side of your knee joint. If I am having pain on the left side, I will be lie down on the right side. So first exercise, hip abduction. Bend your lower knee, upper leg straight. Just take your affected leg, this leg, you can feel pain here on the outer side of hip, outer side of the thigh, or the outer side of the knee joint. So to strengthen the IT band, we will be doing first exercise, a hip abduction. In this exercise, you just lie down on your unaffected side. On the normal side, just take your leg behind and raise it up. So first take your leg little behind, hip extension, and do hip abduction. Just raise it up, hold for 10 count, and slowly down. Okay, the hip abduction, take your leg behind, raise it up, hold for 10 count, and down. You will be doing this 10-second hold and 10 repetition. This is first exercise. In the second exercise, we are using this loop. So this is exercise loop. We will be using this. So just keep your feet together, knee together, and just try to open your knees with the help of this. So this is resistance band or resistance loop. Here are you for this. Just open your knee, hold for 5 count, and do 10 repetitions. Open your knees as much as you can, hold for 5 count, and then relax. Exercise is seated external tibial rotation. Exercise in seated tibial external rotation. You just sit comfortably, and your feet should be supported. Just raise your heels up and take your heels in. Hold for 5 seconds and then take it out. So lift your heels up, take it in, hold for 5 seconds. You will be seeing you are getting a stretch here and release. So raise your heels, take it in, hold for 5 seconds, do 10 repetitions. If I show you from the side, just you are sitting comfortably, just raise your heels, take it in, and hold for 5 seconds, then release. Raise your heels, take it in, hold for 5 count, and then release. Next exercise is monster band walk. you will use a light resistance TheraBand. Okay, with the help of TheraBand, you will be walking sideways. This way. Next exercise is reverse lunge and twist. Stand comfortably, take your leg behind, to lunge. This is 90-90 position and twist from the opposite side. So if I twist on this side, I will be getting stretch here. Okay. So the same leg, you take this leg behind and turn on this side. Okay. I take this leg behind, lunge and twist on the opposite side. Sideways you can see. I'm taking this leg behind, bending and twisting on the opposite side. So I will be getting stretch here. Strengthening of the IT band or the hip muscles. Now will I show you how we can do stretching of the IT band. Okay, so if I am doing stretching of the IT band, you just stand. Okay, cross your leg. If I am crossing my left leg, just bend on the opposite side. So you will be getting stretch here. So we'll hold for 20 seconds and we'll do 2 to 3 repetitions. Getting if my right side IT band is affected, I'm going to cross my left leg. Okay, now bend on the left side. Okay, bend, 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 bend. So you will be getting stretch here on the right side of your thigh and right side of your hip joint. So hold this stretch for 20 seconds